Hey everyone, my name's Brandon. Really happy to share with you my project titled Early Unplanned Readmissions Following Same Remission Cholecystectomy for Acute Biliary Pancreatitis. To give you a bit of background, unplanned hospital readmissions are really important quality metric for both hospitals and health systems. Prior studies have investigated readmissions in patients with acute biliary pancreatitis. However, there's really currently limited data for patients who are readmitted after cholecystectomy for an index episode of acute biliary pancreatitis. To investigate this further, we utilized the nationwide readmission database for the years 2010 to 2014 to capture this population and to investigate the rates, predictors, and causes for early unplanned readmissions among this group of patients, which is best demonstrated here in Figure 1, which is our study schema and really shows you how we went through the nationwide readmission database to capture this population. And we're able to assess for predictors of readmissions and to determine the exact reasoning for readmissions. Moving on to our results, readmission rates were around 7.25% for this patient population. We found that the primary reasons for readmissions were really broadly divided into three major categories that's demonstrated here in Figure 2. One, pancreatitis-related conditions accounted for around 34% of readmissions. This included issues such as recurrent pancreatitis or pseudocysts. Two, surgical-related complications such as uncontrolled pain, bowel leak. This accounted for around 21% of readmissions. And three, other medical conditions such as urinary tract infections, pneumonias, COPD exacerbations, even C. diff infections, which really by and large contributed to the majority of readmissions at around 45%, as you can see over here. To investigate the predictors of readmissions, we utilized the multivariable regression analysis as seen in Table 1 and found that really factors such as male gender, possessing Medicare and Medicaid, severe acute pancreatitis, increased length of stay, discharge other than home, such as SNF or LTAC, and greater than 3 Elix-Hauser comorbidities, really portend increased risk for readmission. Interestingly, we also found that variables associated with decreased risk of early readmission included performance of ERCP and intraoperative cholangiogram. So really moving on to our discussion, I really believe that gleaning from our results, there are several really key take-home points from our research that I believe is highly applicable to clinical practice. And really, one of the big issues is that we've really found that there's a fairly sizable portion of potentially preventable medical and surgical causes for early unplanned readmissions that we've identified, such as C. diff infections, such as uncontrolled pain, and UTIs. We really believe that early interventions, such as judicious use of antibiotics, close outpatient follow-up, and guideline-directed pain management are really, simple, easy options to reduce these potentially preventable admissions. Finally, our finding that the performance of ERCP and intraoperative cholangiograms reduce readmissions actually provides some more support for the routine use of these procedures in biliary acute pancreatitis. So thank you so much for listening to my presentation. Really open to feedback and suggestions for this project. If you have any questions, comments, or feedback, feel free to email me at brandon.chu@osumc.edu. My mentor for this project is Dr. Krishna. And thank you again for listening to my project. Thank you.